Hello friends, I'm Dr. Hall. Welcome to this class. We are going to review the topic Fitness Assessment, Selection and Administration. It is the topic of Chapter 10 of the National Strength Condition Association book, Fundamentals of Personal Training. The book is divided into 4 sections, and these chapters correspond to section number 2, which is called Consultation and Initial Evaluation. This class is pre-recorded and you can analyze it on my YouTube page as additional materials that we can use in some learning activities that we have scheduled for the future. Chapter 10 talks about important aspects of assessing physical condition. As a personal trainer, we establish in the contract an objective to achieve in the future with the client. As a result of the exercise, the client will evolve and improve in their performance. And to quantify the progress is important. We have to assessment. We have to evaluate the client, and there are 6 aspects that the National Strength Condition Association establishes important. You can read them on the page 180 of the book. But in the next slides, we will explain them. In summary, number 1, if we make a periodic assessment, we will be able to make comparisons of physical condition in the future, because this was established in the contract, and also identify the progression of training. Number 2, we will identify weak or strong points of clients' physical condition. We'll compare the client's results with population tables of the same age and sex, and as a personal trainers, we will analyze whether the client is below or above average to improve some aspects of physical fitness. Number 3, when we perform tests, we can adjust the intensity. For example, if we perform an initial test on the client and we want to exercise at 70%, we will use the values of the maximum strength repetition, for example. And number 4, it will also allow us to achieve short, medium, and long-term objectives. For example, we can establish weekly objectives, month or every 4 months. For example, sometimes this is very useful for as a motivational aspect for some clients. Number 5 is another aspect is that a physical test can indicate a possible weakness or future injury, so that it can be considered within the design of the exercise program. For example, low values of flexibility and strength resistance in some tests can give indication of future low back pain. And number 6, and finally, in a legal conflict, as a personal trainer, you have quantified the assessment. You as a personal trainer apply prudent, safe, and specific tests to the design of the client's program. So it's important to evaluate the client. The topic selection and administration of physical condition address important terms for personal trainers, such as test protocol, are procedures required for administrating a reliable test. In the application of physical tests, there are always advantage and disadvantage. The physical assessment test that we choose for our client must to be appropriate and specific to their needs. For example, if we have a client who's in medium and long-term goal, wants to run a 5 kilometers or 10-kilometer race, the logical assessment is not to use a cycle ergometer when performing an aerobic capacity test, such as Astrom rhythm. We can use for this case is better perform a 1 mile or 2.5 kilometer running test. So that's better. But however, if the client is obese, running is stressful for on the lower extremities due the body weight imbalance, and it is best to use a cycle ergometer test. There are always advantage and disadvantage using test protocols. Another important terms for personal trainer are reliability, objectivity, and validity. Test-retest method. On this slide, we can read the concepts. We are going to explain the terms with examples in the following slides. But the most important factor in this topic is that as a personal trainer, you use valid evaluation methods approved by the scientific community. We use appropriate tests for the client, and other factor is that personal trainers must to minimize the error when applying tests. So we must be familiar with the methodology, logistics of applying physical tests, and another factor is try to keep your measurement error minimal when applying the same test. If you compare yourself with another personal trainer. And the first term that we are going to talk about is reliability. It is usually confused with validity, and reliability is consistency in measurement. Measurement performed several times or measurement in consecutive tests. In this chapter, reliability is described as an expression of repeatability of the test, of the consistency of repeated tests. As we can read on the screen, test-retest methods means a strategy to promote reliability by repeating the test with the same individual or group. A test is considered reliable when the variability of the result is very low. In other words, it is when the value between the first assessment and the second assessment is very low. Let's show an example of a client who was assessed for flexibility on 3 consecutive occasions in 3 days by 2 personal trainers. In the results of the first personal trainer, we can see similar values on the screen, which we can consider that the test results were reliable. And the second personal trainer, we can observe that the first measurement is not reliable with the measurement number 2 and the measurement number 3. That is not considered reliable. The personal the reason that we maybe can have a not reliable value can be different. There are many, but for example, the person performed the physical test, the personal trainer was not familiar administrating the test. In this case, the personal trainer was not familiar, and in the first test, the client uses shoes. For this reason, the test was not reliable. Now we move on to another example of objectivity that refers to the consistency of the results between two evaluators. That is, two people evaluate the same subject. We are going to give an example of objectivity of the partial trunk flexion test carried out by two trainers. Personal trainers have reliable values in the three measurements, but a personal trainer was not familiar with the test and did not consider the 10 centimeters for the test. This test was the abdominal crunch abdominal, and the client performed the abdominal muscle contraction with a greater range. Therefore, the values in the test of the two personal trainers are reliable, but the consistency between them is not objective. There is a variability in the results of the partial curl up test. On this slide is the same example. The two personal trainers performed the prone double straight leg raise test on the same client using the same methodology, and the values when they compare to each other were objective, and when the values were compared to each other were reliable. That is why agreement is important in a fitness center, and always values the same and standardize the evaluation protocols regardless of which personal trainer performed the measurements. The next term we need to be familiar is the term validity, which is the degree to which a test or assessment instrument measures what it is supposed to measure. We mentioned previously that sometimes the term reliability and validity are confused, but in other words, validity indicates that the result of a test is true. We can know that a test is valid because it's recognized by the scientific community. There are different types of validity. Sometimes some tests are valid for some populations, such as older adults, such as the senior fitness test, because for older adults it will be difficult for them to perform push-ups, but push-up test is a test valid for a young adult, for example. But push-up test, some methodologies of this test established by validity by performing the test in different position of a woman and a man, because there are differences in body composition by sex. There are valid tests for a sport based on the type of effort or movement. For example, a specific jumping power test for volleyball or agility test for soccer or football. There are also instruments called gold standards, such as DEXA, to assess body composition in the most accurate way as a laboratory test. But there are other valid field tests, such as anthropometry, with a 90% of correlation that estimate body composition values in the same way. Another example of laboratory test is oxygen consumption with a gas analysis, but there are valid methods to determine aerobic capacity through a field test, and determining the maximum oxygen consumption through mathematical calculations. There are valid formulas, and the evaluation is more economical, easy, and sometimes it is the only option for the personal trainer. Another important aspect of this chapter is are the factors that affect reliability and validity. All tests contains a standard error of measurement, which is the difference between personal score and the coach notes the results he has obtained, and his actual score, a theoretical error-free score. The standard error of measurement is sometimes related to the client, and the client factors that affect reliability and validity are in here. There are 4. Number 1, health status and functional capacity. Number 2, age. Number 3, sex. Number 4, pre-training status. We will give you example of 4 factors. Factor number 1 is the health status and functional capacity of the client. For example, if the client has a history of musculoskeletal injury, possibly the client may have a limitation in their performance. Another example when assessing aerobic capacity is if the client is not able to run 2.4 kilometers, the value will not be real. We can choose another modality such as cyclogometer or step test. The factor number 2 is age. There are specific valid tests for children, for example, with the distance is 1.6 kilometer, or for adults it is 2.4 kilometers, or for older adults, which is only walking, like the Rockport walking test. Number 3 is sex. For example, some physical tests such as strength. The difference in body composition is a factor in the methodology to be applied in men and women, as we mentioned in the last slide about the push-ups. Another example is for the YMCA test. The weight used by men is 36 kilograms, 80 pounds, and 16 kilograms, 36 pounds for women. The last one factor is previous states of training, pre-training status. There are tests, for example, that clients with a low level of fitness will not perform them in the first week of training, such as 1 maximum repetition of strength, because they do not have the lifting technique. We can have a measurement error for that reason, but if you will be applied in the future, the 1 repetition maximum of strength could be great after 4 to 6 weeks of training, when the client knows the movement pattern, the technique. In the same way in a beginner client, applying 2.4 kilometer running test, the result could be a mistake. Even doing the test, the client could get injury doing that test. But in the future, it will be a good options. Another important aspect of this chapter of factors that affect reliability and validity is related to the personal trainer. We already explained and we present an example previously about a prone double strain leg rise test. The most important thing is to be familiar with the testing methodology to minimize errors. The next important aspect regarding the factors that affect reliability and validity is related to measurement equipment. The equipment is required to be calibrated with the correct adjustment, to be the device must to ensure precision in the measurements. In this way, the personal trainer will be able to evaluate accurately. The last aspect that marks the chapters on the factors that affect reliability and validity are environmental factors, referring to the temperature and humidity, the altitude, the air pollution, and the facilities. They are important factors that can affect the reliability and validity when applying a test. The most important thing is the integrity of your client, and you as a personal trainer always need to offer security to your client. We are going to explain the 4 aspects in the following slides. About temperature and humidity, the most notable aspect of clients is physiological responses are exposed to heat, to humidity, to cold. It's recommended to apply the test in environment between this range of temperatures values of degrees. And as you can read also on the screen, the humidity is recommended between 65 to 72%, and also in environments with very low temperatures, less than 40 Celsius degrees, it is important to use caution, especially with clients who have adverse health conditions. Other factor is performing a test at altitude that may affect the client's performance in aerobic endurance, because altitudes above 150 and 600 meters, the clients may require an adaptation period of 9 to 12 days before testing to be reliable. Pollution and air quality is a factor that can decrease performance, especially if person has an adverse disorder condition of health. In many cities there the air quality is evaluated. The personal trainer can have access to the values. On page 186 of the books, an example is presented that can analyze the different classification of air quality. And according to the values, the personal trainer may consider the convenience of performing the physical test, especially if the client's integrity is affected. Regarding the facilities, it's considered that the test should be carried out in a quiet space, in a private space, with calibrated equipment, with a specific temperature between 20 and 22 Celsius degrees. Humidity should be 60% or less, and air circulation in the facilities should be between 6 and 8 air exchange per hour. The facilities also must to have safety and emergency protocols, and related to safety procedures and how to act in emergency cases, page 192 presents a table of 10 indications to stop a test, and refers to identifying signs and symptoms of decline, high values in systolic and diastolic blood pressure, and if clients indicate to stop the test, we must to consider, and equipment failure is other factor. The chapters end with a very important topic for a personal trainer, and we need to answer the questions. What is the order in which a personal trainer should administer physical tests? There are an appropriate order that the National Strength Condition Association recommends for applying laboratory tests and field tests. It is a logical order, and it is an order that requires apply the test from less fatigue to more fatigue. The order of the list for the test related to general fitness you can observe on the screen and analyze it. We can start with resting tests. We continue with tests that do not cause fatigue, such as flexibility. In order number 3, we will apply muscular strength tests, for example, 1 maximum repetition of strength. In order number 4, local muscular endurance tests, such as YMCS tests. And finally, tests that evaluate aerobic capacity is the last order, the number 5. Obviously, after the rest test, there must to be warm up before starting the physical test. For the athletic performance test, there are the tests are presented in table 8, and the National Strength Condition Association had the same logical order of applying first no fatiguing test and moving to more fatigue tests. And for athletic performance tests, in addition to the general fitness tests, we have agility tests, speed tests, and anaerobic capacity tests are included in order 3, 5, and 7, as you can see, you can analyze on the screen. Remember to better understand the topic of fitness assessment and selection and administration, read the key points, especially the terms of reliability, objectivity, and validity, and analyze the factors that affect reliability and validity related to your client, related as you as a personal trainer, and related those to the environment. The indications by which a stress test must to be stopped. The 10 indications are important, and the essentials is important. Essential, the order of application, the physical test. Remember the fatigue factor. For example, the general fitness test order is number 1, resting test number 2, non-fatiguing test number 3, muscular strength test number 4, local muscular endurance test, and the last are submaximal aerobic capacity tests. It is important also to answer the study question at the end of the chapter and carefully analyze the case study that are very close to the reality. See you in the next class. Thanks for listening to me.